Warm welcome to all to day 2 of LMHI Global Colloquium 2021. Myself, Dr. Rekha Thomas, will be the moderator of today's session along with Dr. Mohit Mathur. I request Dr. Mohit to welcome the chair. Over to you, Dr. Mohit.
A warm welcome to all the guests. And for today's session, our chairperson are Dr. Jon Falk. Hello, Dr. Falk. Dr. Falk is in the editorial advisory board of Indian Journal of Research in Homeopathy, the publication of CCRH, and she is also assistant to President Living Homeopathy Limited, Hong Kong. Our second chairperson is Dr. Praveen Oberoi, who is Deputy Director General CCRH. And our third chairperson is Dr. Kusum Chan, who is former Professor of Medicine at Nehru Homeopathic Medical College, and presently she is homeopathic consultant at Pushpanjali Crossley Hospital. So we welcome all the three chairpersons, and the theme of today's session is case reports, observational, pragmatic, and randomized control trials. So I will first invite our first speaker, Dr. Radhika Agarwal. Dr. Radhika, over to you.
Yes. Good morning, everyone. So I am Dr. Radhika Agarwal from Nehru Homeopathic Medical College and Hospital in Delhi. The topic for today's session is the usefulness of Robinia pseudoacacia in the treatment of gastroesophageal reflux disease. This topic was a part of my dissertation during post-graduation, so that's why I chose this topic. So as we all know that gastroesophageal reflux disease, it is the most common gastrointestinal disease in the both Western and Asian countries. It is troublesome and it hampers quality of life. Our homeopathic materia medica is full of medicines for heartburn and regurgitation with qualifying modalities or concomitants. However, Robinia pseudoacacia, it maximally covers the symptom syndrome of gastroesophageal reflux disease, but it has been fragmentarily proved. So therefore, this study was undertaken with aim to ascertain the usefulness of Robinia pseudoacacia in the potency 6C in the treatment of gastroesophageal reflux disease. So this study was carried out at Baxen Homeopathic Medical College and Hospital. It's in Greater Noida because I've done my post-graduation from there. And now coming to the material and methods. So the study design is prospective, observational, non-randomized and non-controlled study. The study population, it was taken from the OPD, IPD setups of the Baxen Homeopathic College, and purposive sampling was done. Now, what was the inclusion criteria and the exclusion criteria for this study? For inclusion, I have used GERD questionnaire in which I have enrolled only those patients which had a questionnaire score of more than 8. Then patient of middle age, that is from 20 to 60 years, patient of both sexes, and patients who gave valid consent. Exclusion criteria, I've included those patients with, I've excluded those patients with other systemic disorders or like patients who were pregnant or they had any history of GIT surgery. Coming to the study period, the study was conducted for a period of 18 months. And the intervention given was Robinia pseudoacacia in the potency 6C. For the follow-up, each case was enrolled, each follow-up was done for 2 weeks duration and assessed according to the progress of the individual case. Status of the patient and prescription was recorded at each follow-up and reviewed on weekly basis. Coming to the outcome assessment, the GERD questionnaire was used to evaluate the baseline score and after the 6 months treatment by using the paired t-test. So the statistical test used was paired t-test here. Coming to the main part, observation and results. So the cases were analyzed according to the age, gender distribution, BMI, and the gradation according to GERD's questionnaire score before and after the treatment. and also improvement index was analyzed. So as we can see from the charts that in for the age, for the aged 30 to 39, we can see the maximum number of cases here. And for the gender distribution, male had more incidence of GERD. Coming to the BMI, the maximum incidence was seen from 26 to 28 kg per meter square, and minimum incidence was seen at 20 to 22 kg per meter square. And the gradation was done according to the GERD score. So moderate maximum cases were the moderate cases, and the after treatment GERD score, most cases were from moderate. They came under mild category now. So the categorization was done like for mild cases, 0 to 7 GERD questionnaire was the mild. For the moderate, it was 8 to 13, and for severe, it was 14 to 18. So that is how the classification of mild, moderate, and severe has been done. Now coming to the discussion part. So as we see in this study, the highest incidence was seen in the age group of 30 to 39, and males were more affected as compared to females. And incidence was more in 26 to 28 kg per meter square BMI. The prominent clinical symptoms were heartburn, regurgitation, water brash, and nausea. As per the GERD questionnaire, 28 cases are moderate and 2 cases as severe. All the patients showed a significant reduction in the post-treatment score as compared to the pre-treatment score. Out of the 30 cases, 1 case cured and rest all showed a good improvement. The p-value was found to be statistically significant. This clearly indicates that Rubinia in 6C potency is useful in the treatment of GERD. Now, what were the limitations of the study? Firstly, it lagged control arm and prescription on common symptoms due to lack of the characteristic symptoms. There was no scope to change this potency for which the need was realized during the study. Due to the short duration of follow-up and prescription of only 6C potency, the clinical symptoms of Rubinia could not be identified. Results: all enrolled cases completed a follow-up of 6 months. Out of the 30 cases, 1 case was cured, 26 showed a good improvement, and 3 did not respond to the treatment. Overall, statistically, the significant difference was found in pre- and post-treatment GERD questionnaire scores. The study has shown positive result in terms of usefulness of Rubinia in the treatment of GERD. Further RCTs with long-term follow-ups needs to be conducted for definite conclusions. Thank you.
Thank you, Dr. Radhika. I would request the chairperson to give some valuable comments.
Thank you for the presentation. And yeah, it is good to see such a prospective single group pre and post test study with 30 persons. I think the content is quite okay. It's just arrangement of the information. It seems that you have put the information that should be put in the result part, in the discussion part. Maybe next time it would be better to arrange it like the result and then further discussion. Otherwise, it would be sometimes confusing to if you want it to be published. Yeah. Thank you.
Okay, thank you. Thank you.
Dr. Radhika, you have not mentioned in your study that the consent was taken from the patients. Of course, that must have been taken, but in the exclusion criteria, it should be mentioned over there that the consent from the patients was taken. Is it so?
Hanji, ma'am, I've included that in the inclusion criteria that the patients who gave valid consent, only those were included.
Okay. And how do you diagnose your cases?
Ma'am, diagnosis was done through the GERD questionnaire. I haven't used any invasive procedure for the same. I mean, for the diagnosis of GERD.
And what was the criteria of cure of the cases? What was the score for cure?
Ma'am, for cure, the cases which had below 3, like or the GERD questionnaire, it was from 0 to 18. So the cases which had below 3, those were termed cured.
And you have not included cases from 3 to 8, basically, because your
Yes,
criteria of
ma'am.
inclusion was more than 8. What was the reason
More than
for
8.
that? What was the reason for
Ma'am,
that?
ma'am, because I wanted mild, I wanted mild to moderate category, not severe or not like below less than 8. So that's why.
Okay, thank you.
Thank you, Dr. Praveen. We will now invite our second participant, Dr. Manisha V. Solanki. Dr. Manisha, please start. Dr. Manisha, please start your presentation.
Yes, sir. Hello, everyone. Hello, dear colleagues. I'm Dr. Manisha Solanki, Professor, Department of Practice of Medicine from Pune Homeopathic Medical College, India. I'm going to share with you all the case report on acute liver failure, a rarely encountered clinical entity in our clinical practice, whereas homeopathy has given a significant relief in the adjuvant management of this acute fulminant hepatitis, acute fulminant liver failure case. As we all know that acute liver failure is a clinical condition which is characterized by acute deterioration in the liver function, resulting into encephalopathy and coagulopathy. This further results into deterioration in the liver function within say 6 to 26 weeks of onset of symptoms in a patient who does not have the prior liver complaints or prior liver disease. Finally, they result into multi-organ failure and they have got a very high mortality. So most of these patients are usually, they need an intensive care unit management where the supportive line of treatment is given, and liver transplant is the only line of treatment or the only definitive line of treatment for the patients who suffer with acute fulminant liver failure. Now, the purpose of sharing this case report with you all is that in our study, we found that the homeopathic intervention has given a great improvement in the metabolic as well as synthetic function of the liver, which is obviously an evidence-based study. It has also prevented the progress of encephalopathy and coagulopathy and has done a great reduction in the predictive factors that account for the 30 days of mortality in patients with acute liver failure. So this is a case of a patient who is 71-year-old who was admitted into a multi-specialty hospital of Pune, a very reputed institute, and he was taking treatment under the consultant in charge and gastroenterologist, where they advised at the end of a month, I think there was very little improvement and they were insisting for liver transplant. This patient was admitted for loss of weight, anorexia, distension of abdomen, jaundice, and had some of the hemorrhagic phenomena like petechial hemorrhages and all that. So after the 1 month's treatment, when the consultant physician insisted for liver transplant, the patient and the family members, they were not keen for going for liver transplant and they thought of taking homeopathic medicine. So when they visited to our OPD, at that time, his liver function was deranged. Serum bilirubin was almost 20 mg%. His prothrombin time was on a higher side. The serum albumin was very low and serum creatinine was also altered. So after explaining about the homeopathic intervention to the patient and his family members, after taking the proper consent, also informing the treating physician, because the patient was admitted in the multi-specialty hospital, we took the consent of the patient, and after going through the detailed reports which patient had done, we took a case taking. The thorough case taking was done, and based on the homeopathic principles, depending on the presenting symptomatology of the patient, we prescribed homeopathic medicine, the single medicine at a time. Lycopodium was the main medicine which we prescribed. This patient needed a frequent follow-up and assessment, both at the level of clinical assessment and at the level of biochemical and metabolic assessment of the patient, that is liver function test. Now, this page, in the outcome assessment, I would like to state that the outcome assessment was done on the basis of improvement in the liver functions. And if you can see the graph, there is a progressive, after the homeopathic intervention, there was a drastic reduction in the serum bilirubin and the prothrombin time. And then followed by that, persistently, you would find that these values are showing a progressive improvement. So not only the improvement in liver function test was seen, we also applied the criteria for causal relationship after the intervention with homeopathic medicine and the clinical outcome. So we studied with the modified Naranjo's criteria, where that also initial assessment after intervention, the score was 7. After that, the score became 11. The patient is still with us, and there is an remarkable improvement in the patient's biochemical and the clinical signs and symptoms. Also, MELD score, that is the model for end-stage liver disease, was assessed pre and post treatment, and that also shows a significant improvement after the homeopathic intervention. So, my dear colleagues, before concluding, I just want to say that even though this is a single case report, it is an evidence-based case study, and we understand that the robust research model is required before we further go with the assessment of homeopathy in such acute manifestations of the cases. But we cannot underestimate the role of homeopathy in this case, which has played a significant role in arresting the progress of acute liver failure. It has prevented encephalopathy, coagulopathy. It has prevented the liver transplant to that extent that patient is not going to go for liver transplant now, because his liver functions have almost come down to the normal values. And we have obviously reduced the mortality in this patient. Over and above, the patient is very grateful to this science of homeopathy because he had a minimum economic burden while going through this management. And before I conclude, I want to acknowledge my patient for having faith, and his relatives for having faith in this system of medicine, and my co-assistant doctor, Dr. Prajisha, for helping me in a meticulous follow-up of this case. Thank you.
Thank you, Dr. Manisha. Over to Dr. Fogg. Do you have any questions? Please.
Yes, please. Thank you for your presentation. I did not see any description of the more clinical side when you first start the remedy. Do you have any description of the did the patient aggravate at the very beginning or not? Or how is the change of the clinical symptoms at the very beginning of the treatment?
Yes, ma'am, the patient was admitted into the intensive care unit of a multi-specialty hospital. At the time of admission, patient had the higher function alteration. He was drowsy. His reversal of sleep rhythm was there. And patient was under treatment for 1 month. The patient's relatives came. So patient was admitted in the first week of June. Patient's relatives, they came to me in the first week of July. That time also his liver function tests like serum bilirubin and all other values were very high. Patient had loss of appetite. His icterus was very marked. There was an abdominal distension. Lot of anorexia was there. And as I said, the deterioration in mental function was, patient had some hallucinations. The sleep was altered. He was sleepy during day and completely awake in the night. So these were the presenting features at that time. Regarding the individualizing history, when I took, as I said, that the initial prescription was lycopodium, we went into the life space of the patient also, and there was one very marked feature which made us think of lycopodium, and it really gave a good result with the reduction in the liver function, that the patient had distension of abdomen. Even a little food, if he used to take, there used to be fullness of abdomen. He had a marked craving during this acute illness also, which was there before also, but he had a marked craving for sweets, and he wanted boiling hot. He wanted hot food and hot drinks. And I think that was very important point which led us to think of lycopodium. And when we assessed after the intervention of lycopodium, we can see that his serum bilirubin, which was 20 milligram, had dropped down to 9 milligram percent after around 10 weeks of duration. And then persistently it is down. His recent reports last week show that bilirubin is only 2 milligram percent, and his prothrombin time has also come down to from 28 seconds to around 17 seconds. So he's still under the treatment.
What is the first improvement of his clinical? I do not mean the investigation results.
Okay, fine. So the clinical improvement was like, as I said, that when he came, when he was admitted, he had flapping tremors. His consciousness was little altered. We had to wake him up to answer the questions. So he was drowsy, and now he is up and around. He's walking, he's doing his day-to-day work. He's attending his, he is a social worker actually, because post 71 years, he's doing some social work. So he's attending his meetings with his NGOs. That's the improvement I want to say. So his higher function has improved, his appetite has improved, his jaundice has reduced, his bowel movements are better, and his abdominal distension has also reduced.
Thank you.
Dr. Oberoi, ma'am, do you have any questions?
And just I will like to have one question. Madam, you had given first prescription as lycopodium 200.
Yes.
Thereafter, you have given arsenic album 30 and
Yes.
Nux vomica 30, and again lycopodium 200. What was
Yes.
the reason for that?
Yes. So as I said, that this patient was critically evaluated every week, maybe even 2 days after. This being an acute fulminant condition, ma'am, what happened is that the initial prescription we gave lycopodium for 1 week, single dose daily. Patient showed improvement, but there was a marked weakness, and the features like he had dryness of tongue, dryness of mouth, and he was asking for sips of water. So all that totality which drifted from lycopodium, we thought, to arsenicum album. So if you see that after lycopodium, there is a great relief, and after giving arsenicum album, though his presenting symptoms, they relieved, but there was no marked improvement as far as the biochemical and the other liver function tests. So every time we had to retake the case in an acute presentation. Then irritability was too marked, and he became very aggressive while talking. So the totality shifted to Nux vomica. All these acute totality was also repertorized, and we saw the medicine which was coming. Unless and until it was matching, we did not change the medicine. Finally, I can say that lycopodium has given a great relief to this patient, but we can't, in an acute patient, when patient is coming with acute presentation, which is really bothering, and he's admitted in the hospital, we thought of changing the medicine. Once the medicine was given and the totality changed, we also had to retake the totality, and we had to give another medicine. So it was one medicine at a time, but we had to change the medicine, ma'am.
And whether you have given the add-on treatments of allopathic medicines, whatever he was taking,
yes,
or they were completely stopped?
Yes, ma'am. This is an add-on treatment because patient was already admitted in the hospital, supportive line of care was going on. Even they had given plasmapheresis, which is like an artificial liver functioning, but the improvement was standstill, and they wanted only liver transplant. And so their line of treatment was going on. It was an add-on therapy. Otherwise, ethically, it would have become very difficult for an admitted patient for me. So with the consent of the patient, with informing to the in-charge consultant and a gastroenterologist, we did this management.
So this was really a very good case as such. So we need to conduct some more studies for such type of cases in the integrative manner. Thank you,
ma'am. Thank you so much, ma'am. Thank you.
Thank you. We move on to our next participant, Dr. Ram Kumar. Dr. Ram Kumar, do you have your presentation ready?
Good morning, all. I will share my. Yeah, good morning, everyone. First of all, I thank the organizers and our director for giving me an opportunity to present this uh, case report. Today, I'm going to present this case, a case of pediatric cholelithiasis, which was successfully treated with homeopathy. As we all know, cholelithiasis or gallstone are a major public health problem worldwide. Although gallbladder disease had traditionally been considered an adult condition, the prevalence has been rising in the pediatric population because of increasing use of ultrasonography and rise in the childhood obesity cases. A population-based study estimated that the prevalence of gallstone in children is about 1.9%. Ultimately, the gold standard treatment for this is the cholecystectomy, is the procedure of choice for symptomatic children with cholelithiasis. There is a significant interest in alternative medical treatment modalities since non-conventional therapies are most appealing to the patient. The purpose of this case report, to report this case, is because of the severity of our complaints and the positive outcome after the treatment. And it is also an evidence-based case report. Here, the usefulness of individualized homeopathic treatment is highlighted in this present case. Well, this is a case of a 6.5 years old female child who came to our OPD with a history of severe recurrent abdominal pain along with nausea and vomiting, which she got aggravated after taking oily foods, which she craves a lot, for the period of the last 1 month. Her pain is so severe at times, incapacitated her and prevented her from carrying out her day-to-day life activities. This patient, unable to bear this pain, this patient was admitted in an hospital where she has undergone all the investigations, including the routine blood investigations, and ultrasonography was done. The ultrasonography report confirmed the presence of multiple stones in the gallbladder of varying sizes from 4 to 5 mm to 10 mm, the maximum size. Where she was undergone various medical treatment was given, and at last with no resolution of her complaints. And finally, she was advised cholecystectomy by the surgeon. Fearing surgery, the parents were reluctant to undergo any surgery. At last, on recommendation of their friend, they have come to a homeopathic treatment to our unit. And the thorough case taking was done, and case was analyzed. While analyzing the case, the general and particular symptoms were classified as per the intensity and evaluated as per the merit. Characteristic mental generals, physical generals, particulars, and few diagnostic symptoms were considered for erecting the totality of the symptoms. And while taking the case, there was a significant history or past history. She was a giant urticaria was there, and there was a family history of diabetes and bronchial asthma was being found. After erecting the totality, the case was evaluated and it was repertorized using the synthesis repertoire was selected, and radar software was used for repertorization, which can be shown in this figure 2. A few repertorial rubrics here presented are mind mildness, timidity, abdomen pain, liver gallstone colic, stomach nausea, stomach vomiting, general food and drinks, fat desire, general food and drinks, fat aggravation, and mind weeping with pain was taken into consideration for the repertorization. After repertorization, from the list of remedies, Pulsatilla was selected after consultation with the Materia Medica, and Pulsatilla was prescribed to this patient in 30th potency, followed by 200 potency following an episode after a month. After Pulsatilla 30, the patient showed a drastic change in her complaints. Pain is intensely reduced after the second day of the treatment, followed by other elevation in their other complaints. There is a marked reduction in the frequency and severity of her pain. Even her abdominal bloating, nausea reduced, and so that she was able to do her day-to-day life activities calmly. And this patient was the patient was asymptomatic for almost 3 months, after which the repeated ultrasonography was done, which showed no significant abnormality or no calculus, which is shown in this figure 4 after treatment. It is shown here. Even in the initial report before treatment, there was a mild thickening of the gallbladder was also found, and everything was resolved after treatment. So finally, to conclude, just I want to say a few words. Though there are very few cases has been reported, after reviewing the literature, there are very few case reports have been found to be reported in this literature related to this pediatric cholelithiasis, which was treated with individualized homeopathic treatment. This is my other spot to present this case, and this case also very much corroborates with the previous case which has been reported. To conclude, the case has been viewed in respect of both symptomatologically and pathologically, as is evident by the follow-up investigation. The case of pediatric gallstone has significance to report shows that such surgical conditions can be well managed with individualized homeopathic medications. Hopefully, additional clinical research and illustrative case reports will add to wider utilization of homeopathic in these conditions. Thank you. For this, I would like to acknowledge my co-author, Dr. Harini, who have been there to meticulously working to present this case. Thank you.
Thank you, Dr. Ramkumar. I would request Dr. Fogg, if you have any question.
Thank you for the presentation. First, I would suggest for the other presenters, when during your presentation, I think it would be better if you can enlarge your screen. I mean, enlarge your poster so that we can. Yeah, I know it's really, really small on our screen that we can hardly see anything. But yes, I would like to ask, when you saw the patient, do you know if the patient got any significant like genetic history or other hereditary diseases that leads to such a situation, or it's just like a purely gallstone disease?
There was no significant disease. It's purely a plain straight case of pediatric cholelithiasis.
Okay. All right, thank you.
Even our blood reports, everything, it was normal. Only ultrasonography showed the presence of gallstones, multiple gallstones.
And the family history is like a normal.
There was no family history, and otherwise, even the patient could not reveal any of the significant history related to it.
All right. Okay, I do not have other questions.
Thank you, Dr. Fogg. Dr. Oberoi? Do you have any questions?
No.
I just want to ask one question. Why do you say that it is a pediatric cholelithiasis? Because there is no, besides the age that the patient is of, patient is a child. Otherwise, not even the repertorization, you have taken any rubric like that.
So
why are you specifically, only for the age you are saying it is a pediatric cholelithiasis, na?
Yeah. Yes.
And your duration of treatment was for how many months?
Almost 4 months, ma'am. After 4 months, the case was repeated ultrasound was done.
And is it the patient still under follow-up?
Yes, ma'am. Till date, the whole family is under homeopathic treatment, and patient is almost gone. Almost 10 years have been completed. She's hale and healthy. She's having a healthy life.
How many stones were there earlier in the gallbladder? How many stones were there? Multiple?
Multiple stones, madam. 4 to 5 mm or 6 mm.
And all the stones have gone?
Yeah, yes, ma'am. That has been depicted in this report.
Very nice. Okay, thank you.
Even there was a mild gallbladder wall thickening was there in the initial report, and even that too has been resolved.
Okay, thank you.
Okay, thank you, Dr. Ramkumar. We now invite our next participant, Dr. Shahjahan Abdul Rahman. Dr. Shahjahan. Dr. Shahjahan, are you there?
Sir, he is not present.
Okay, then we will invite our next participant, Dr. Subhranshu Prabha Mishra.
Everyone, good morning to all. Myself, Dr. Subhranshu Prabha Mishra, PG scholar from Batson Homeopathic Medical College, going to present my poster on the title Management of Irritable Bowel Syndrome Pertaining to Stress by Homeopathic Medicine Lycopodium clavatum, a case series. So introduction is irritable bowel syndrome is a chronic non-inflammatory disease characterized by abdominal pain, altered bowel habits consisting of diarrhea or constipation or both, and no detectable pathological changes. A variant form is characterized by painless diarrhea. It is a common disorder with a psychophysiologic basis called also spastic or irritable colon. The global prevalence of this is estimated to be 11.2% with a range of 10 to 15%. IBS is of three types, that is constipation predominant IBS, second is diarrhea predominant IBS, and the third one is mixed type of IBS. Since it is a stress sensitive disorder, the treatment of IBS should focus on managing both mental and physical symptoms. Hence, homeopathy can prove to be highly effective in such cases as it is based on holistic approach. The objective of my case series was to evaluate the effectiveness of Lycopodium clavatum in patients with irritable bowel syndrome pertaining to stress by assessing the improvement in IBS symptom severity score scale and improvement in the level of stress via perceived stress scale. Coming to the methodology, informed consent was taken from each and every patient, and they were informed about the data may be used for the publication purposes. In this case series, 6 patients of adult age group of both sexes, irrespective of socioeconomic status, having clinical features of IBS satisfying Rome 4 criteria, were treated with homeopathic medicine Lyco, prescribed on the basis of totality of symptoms based on Kentian method of evaluation. The response to the treatment were assessed at each follow-up after 15 days by the change in presenting complaints or appearance of new symptoms, and scales were filled up at 1 month interval. So the first case is a male patient of 35 years old, and the totality of symptoms are mental symptoms more important I have taken in this case series. So the first totality of symptoms are ailments from anxiety, concentration difficult, want of self-confidence, increased sexual desire, burning pain in throat, regurgitation of food, morning diarrhea, and urging immediate for stool since 3 years. So the diagnosis is IBS-D, and the first prescription was Lycopodium 200 followed by Saclac. After two follow-ups, on third follow-up, I changed the potency to 1M because the case came to a standstill condition. And after total 5 follow-ups, the scores were improved in both the scales. In the second case, he is a male patient of 50 years. The mental symptoms were irritable, aversion to responsibility, violent at her sister, disturbed sleep with palpitation, dreams of falling down, and constipation, and all the symptoms were directing towards the diagnosis of IBS-C. So on the basis of this totality, I prescribed Noxboom 200 followed by Saclac. And in after second follow-up, I changed the medicine to Lyco 200. On the justification is remedy that follows well as a second prescription. And after 6 follow-ups, the scores in both the scales were improved. Third case is a male patient of 30 years old. The mental symptoms were careful, desire to be alone, reserved, less talkative, desire to be silent, and flatulency, and all the particular symptoms are directing towards the IBS-M. And I prescribed China 200 followed by Saclac. And after second follow-up, I changed the medicine to Lyco 200. Justification is change of the remedy due to appearance of new symptoms. And the total follow-ups were 5. And after 5 follow-ups, the scores were improved. And fourth case is a male patient of 45 years age. The mental symptoms were desire for company, does everything in a planned manner, introvert, reserved, worried about income, appetite decreased, that is a physical general, and all the symptoms are particular symptoms are directed towards IBS-C. So the prescription was Lyco 200, first prescription. And in the second prescription, I changed the potency to 1M in the third follow-up. And after total 4 follow-ups, the scores improved in both the scales. Fifth patient is a female patient of 35 years age, and her mental symptoms are anger, brooding about past anger, desire for company, consolation, amelioration, obstinate, and all the particular symptoms are directing towards IBS-C. And I prescribed Pulsatilla 200 in first prescription, And in second prescription on first follow-up directly, I prescribed Lyco 200 because justification is remedy that follows well and complementary, and there is also change of the symptoms which are more directing towards Lyco 200. So I changed the medicine immediately in the first follow-up. And the total follow-ups were 5, and the scores were improved in both the scales. Last case is a male patient of 50 years old, and the mental symptoms were cannot bear contradiction, ailments from silent grief, and all the particular symptoms are diagnosed as IBS-C. And first prescription was Ignatia, and second prescription is Lycopodium 200 on second follow-up. The relationship is remedy that follows well, and after 5 follow-ups, the scores in both the scales were improved. So observing these all the 6 cases, I came into the conclusion that Lyco was found effective with 200 potency in 4 patients and 1M in 2 patients, out of which it was prescribed as a second prescription in 4 patients in the management of cases of IBS pertaining to stress, along with improvement of score in both the scales. And IBS-C was prominent type among them. And a thorough study of the rubrics used in Kent repertory were referred in different literatures of Materia Medica and Organon of Medicine to evaluate the usefulness of Lycopodium. And an interesting thing was found that few symptoms were not present under Lycopodium in Kent Materia Medica and few other Materia Medicas, but the same.
Dr. Mishra, you have to conclude. Time is running. You have run out.
Yes, sir. So, as it is a psychosomatic disorder, so I prescribed Lycopodium on the basis of mental generals. Lastly, I would like to thank LMHI for giving such a beautiful opportunity to present here. Thank you, sir.
Okay, thank you. Thank you, Dr. Mishra. Over to the chairperson, Dr. Falk. Do you have any questions to ask?
Thank you. If I do not understand it wrongly, so you have select out 6 patients who has found to be improved by Lycopodium, right?
Yes.
How many cases of IBS patient was seen in this period? How many patients of that? I mean, what is the proportion of the patient that has been found to be improved with Lycopodium?
Ma'am, I have seen 30 patients during my study period. This was actually my thesis, so a dissertation topic, and I have seen 30 patients, out of which 6 patients were prescribed with Lycopodium clavatum, and 2 patients were prescribed with 1M potency, and 4 patients with 200 potency.
Dr. Praveen, ma'am.
What made you, Dr. Mishra, to think of Lycopodium in cases of IBS in your thesis? This was the topic of your thesis, or
Yes,
you have for this presentation only?
Of my dissertation. Actually, I prescribed on the basis of Kent repertory. So after reporterization, in all the 6 cases, Lycopodium was there.
Not only for these 6 cases, you prescribed Lycopodium, but
Yes.
topic of your thesis was of medicine Lycopodium.
No, ma'am.
No, that is what I wanted to ask.
Yes, ma'am.
What was the topic of your thesis?
My topic is irritable bowel syndrome pertaining to stress, homeopathic management only. Not
pertaining to, not for Lycopodium. And what were the limitations of, what was the limitations of this?
Of irritable bowel syndrome pertaining to stress, a observational study.
Okay, that is what I wanted to know, because in these cases there are some cases when mental mind symptoms are also not relating to Lycopodium. So what was the limitation you found in these cases?
Ma'am, limitation is that I period of follow-up was only 2 to 3 months. So the score improvement of score in the scales were not observed that efficiently what I expected to observe, because of lack of follow-ups and lack of period of observation follow-ups.
Okay, thank you.
Thank you, ma'am.
Thank you, Dr. Mishra. Our next participant is Dr. Nike Bhutia. I can see Dr. Nike is not here. Dr. Nike Bhutia.
Sir, actually, she has cancelled the poster presentation.
Okay. Then I will invite Dr. Sunil Canada. Dr. Sunil, please share your presentation.
Good morning, everyone. I would like to start my poster presentation with the slogan that when in the family, when mother suffers, everyone suffers. When someone is suffering,
Sir, pardon. Can you just please enlarge your poster? We cannot see it.
okay, how to enlarge?
Sir, there is a plus option. You can see it above.
Now,
Better, sir. Sir, can you enlarge it more?
uh, less button, in the more option, ma'am.
No, not in the more option. You can see a plus sign
Add on.
No.
adjacent to it.
The magnifying glass just above your presentation in the screen, just above, yeah, you can say magnifying glasses. There are buttons. They're the top left button.
Just adjacent to add to. Yes, this magnifying glass plus sign. Yes, adjacent to it, sir.
See all photos.
No.
No.
In the opposite direction, adjacent to it. Plus sign.
Never mind, you go ahead.
Yeah. Better. Yes. So when mother suffers in family, every members of the family, they suffer. Because to authenticate that, I would like to say that in today's presentation, also, most of them are female, and importance should be given to them. So my presentation is one of the suffering of women, that is called a recurrent urinary tract infection in postmenopausal women. So here I have taken the cases. It is seen that recurrent UTI is one of the most common diseases that the female they have, and then mostly the presenting symptoms are cystitis and urethritis. And as I said that this is one of the most important suffering that female have. One or other day, they reach the menopause. At that particular point of time, the female may have or may not have the UTI. So in case the person, if they suffer from urinary tract infection, it is the most difficult situation which cannot be shared with any other member of the family or to the friend, because it is not like other suffering like blood pressure or diabetes, which can be shared with everyone. This is something related to inside, so it is very difficult to share. So female, they usually suffer, and then suffering increases. They try many medicines, and after getting all when that treatment is not successful, people they switch to homeopathy, and it is seen that this is the best system of giving treatment to such women. As I have taken 30 cases during my dissertation for post graduation, I have taken 30 cases. Out of that, 25 cases responded with homeopathic treatment, 5 did not. So how this 25 responded to my treatment was, I have taken the importance of symptomatology. I have arranged the symptoms according to their importance, starting from mental, physical, general, physicals, and then concomitant. Similarly, and I have taken it in a radar version of synthesis 9.0. And after individualized homeopathic medicine given to them, responded very well. And the most important and the maximum number of medicines that I have used was medorinum, nitric acid, berberis vulgaris, and natramur. So statistically, I have seen that p-value is less than 0.05, and chi-square test was calculated and value was 13.5. So I have seen that it is very effective, and then it is very effective. And I thought that this must be presented in national or international level. So I have not gone deeper how these cases I have done it, how the case taking was done. The details are not given, but simply I have given it in a very simple way. And you can see that in the frequency also it is given the how that medicine was given and which medicines comes frequently. And final outcome also, you can see that out of 30 cases, 25 responded very well. And conclusion, the study shows that the homeopathic drugs are effective in management of recurrent urinary tract infection in postmenopausal women. But larger studies require to be established to improve this study. So I am presenting it in very short. If I go deeper, it will take time, and then time is very limited. So this is my presentation. So I won't take much time also. If any one of you have any question, you can ask. Thank you.
Thank you, Dr. Rio. Any queries? Dr. Von Fock, ma'am, please.
Thank you for the presentation. I'm not sure if I understand it wrongly, but the follow-up time of the patient is 1 month?
No, ma'am. After first case taking, follow-up was made after 1 month. Suppose if the patient make 3 visits, then it means 3 months.
Okay.
If patient make 4 visits, means 4 months, ma'am.
Okay. So and your report, the results, your compare. I mean, your pre and post assessment is at the 3 months period, or how long is it? How long is the follow-up period?
No, ma'am. It depends upon patient to patient. If they come back after 2 months, if they come back after 3 months. So like one follow-up means from my side, it is 1 month, but sometimes patient, they come after 2 months also.
Okay. So I think for an observational study,
yes,
we have to understand what is the time frame of the follow-up so that we can assess whether the evaluation is in an appropriate time frame. For like recurrent urinary tract infection, that you should have provided like what are the most common frequency of attack of the patient. Like if the patient have recurrent attacks for like two times a year, then a follow-up time of like 1 or even 3 months would not be necessary, would not be appropriate. And besides, if you're trying to collect the data and present as an observational trial, because I saw on the checklist that it is presented as an observation study. If it is an observational study, then even if for a single group patient, you have to set a standard observation time for your cases, your cases. Otherwise, it will not. We do not have a standard evaluation of the cases. Thank you.
Thank you, ma'am. Dr. Praveen?
I agree with Dr. Folk, what she has said, but I just want to ask you one question. These cases were taken from the OPD or your private practice?
No, ma'am. Actually, it is my dissertation for my PG. So it was, everything was done at the OPD of National Institute of Homeopathy, Kolkata, ma'am.
Okay. So at that time, since you are saying that this is the most irritating symptoms of the woman, what they presented, and keeping the follow-up for a 1 month, first period for follow-up for 1 month is not good. Because if the patient is suffering, she needs to have more frequent follow-ups. Was there any chance given to the patient to have frequent follow-up?
Yes, ma'am. Actually, some patient has been given 4 months, 5 months.
No, this is for the follow-up period, na? First follow when the patient, when you have prescribed the medicine.
Mhm,
After
mhm.
that, the first patient will be reporting to you after 1 month, na?
1 month, yes, ma'am.
So that is a very long period, because patient is who is suffering. His
Mhm.
suffering will, if she is improved or not improved, you can't say, na.
Ma'am,
So
this, yes, yes, yes.
so whether the patients were taking add-on treatment with that?
Yes, ma'am. Actually, as you said that those persons suffering waiting period for 1 month is too long. Yeah, that I understand. But these are the patients who have come from after taking treatment from other system of medicine. They give me time. They don't have option for waiting 1 month. So and then yes, ma'am. All symptoms were taken, and it was confirmed with laboratory investigations, which are very much available in National Institute of Homeopathy with less cost. So people in West Bengal, they
And
are
after
poor.
treatment also laboratory investigation was done?
Yes, ma'am.
What investigation was done?
It was routine investigation, and then after that, to confirm that urine culture was done before and after treatment, ma'am. And yes, ma'am.
Okay.
So
Okay, thank you.
so thank you.
Thank you, ma'am. Any queries? I think we'll move on to the next speaker. Thank you, Dr. Rio. You can
you.
stop the screen share.
Thank you.
We'll go on to the next speaker. We have Dr. Rakesh Thakkar. He will be presenting on assessment of homeopathic competence in benign prostatic hypertrophy, a retrospective observational study.
Good morning, everyone. I'm Dr. Rakesh Thakkar, and I'd like to present the poster on assessment of homeopathic competence in benign prostatic hypertrophy. It is a retrospective observation study done in Nehru Homeopathic Medical College. I'll just share the screen first. So, actually, we are running a genetic OPD in Nehru Homeopathic Medical College, where we see genetic patients, but more focus is on the benign prostatic hypertrophy, where we do the study. We have taken an observation study of 2 years, and basically this is disease which the old age, especially having a psychosocial impact on them. So regarding that, that's why we have taken, plus the incidence is also much more. So we have taken this as a study main focus in genetic OPD clinic. So aim of study was to assess the competence of homeopathy in BPH management. Now it is a retrospective unicentric observation study where we take the 50 patients, visit the OPD, their data were collected, and the primary outcome was based on the International Prostate Symptom Score, values more than 6 months, and PSA values of less than 4 ng per ml. Right. Basically, it was the IPSS score was taken because it also gives the idea of the quality of life the patient is having. The secondary outcome was the prostatic weight and residual urine volume, which was used for assessment of secondary outcomes. Now, results which were taken out for 50 patients, median age was taken, the 62 was the median age. Most commonly reported symptoms were increased frequency of urination, urgency to urinate, dribbling of urine 55%, weak urinary stream, and retention of urine. Now, the IPSS score was done 3 months. The 6-month study was there. So 3 months we have done the IPVS score, and we have observed that in 43 cases out of 50, there was improvement or there was change, and there was no change observed in 7 cases. Among the 43 cases, IPSS score values decreased from severe to moderate. In 2035, the score was there. Moderate 8 to 19 was there in 16 patients. 13 patients showed improvement in the severity to moderate scale. And moderate to mild, there is 1 to 7, the score is there in 22 patients. 5 patients remain in the mild category. Plus, we have taken the reduction in prostatic weight of 34 patients, was observed. 8 patients remained the same, and there was a slight increase in values of 1 patient. There was also considerable decrease in the RUV, which was observed in 32 cases, 64 cases, 64%. However, there was a mild improvement in 6 patients, and negligible changes were found in 5 cases. So regular follow-up was taken for 6 months, 38 patients. After comparing the treatment results, pre and post 6 months, difference in mean values and everything as shown. The IPPS score before pre-treatment is 17.814 and 8.97, and after treatment, this is the changes which you are finding. Now, the most frequently used medicines were conium and lycopodium, followed by Truja, Pulsatilla, and Strepsirrhea. So the effect is there of the homeopathic medicine, but what is required is much more comprehensive study or more detailed study, or through a RCT, which can do further validate our efficacy. So this is my conclusion, that some RCT has to be done. We want to follow this encouraging results which we get. Right. Thank you.
Thank you, Dr. Thakkar.
Yeah.
Yeah. Dr. Wonfok, ma'am, please.
Okay, thank you for your presentation. May I know more about the dropout rate and the selection of patients? So it is a retrospective study, right? So
Yeah.
in the clinic, how do you select the 50 cases? And for these 50 cases, how is the dropout rate?
50 cases were taken where, depending on the symptoms which they presented, and the IPVS score, which was there, severity was there, moderate was there. All these cases were taken, and dropout are there. I mean, if you talk the number of patients which visit the clinic, we have taken only 50, but dropout was there because they couldn't follow it up. They couldn't come regularly for the treatment. So dropout rate maybe, I think 20% will be there dropout.
So all the 50 patients, so there are no other patients which has met your inclusion criteria but not included in the study, right?
Yeah.
Dr. Thakkar, since this is a retrospective study, and you are saying that you have used the ITT also, and dropout rate is so long, I think there is some confusion. It is not showing clearly how it was a retrospective study when you use the ITT also for getting the analysis.
Okay. No, means if anything improvement is required, you can please suggest, because what we have done is a study and we've taken 50 cases.
And then how ITT was used as per your methodology? You have mentioned that ITT was analysis was done as per ITT. Dropout rate was 20%. You are saying?
Yeah, that I'm not agreeing having the exact figure of that, but this is what I.
Basically, whatever dropout rate is in the retrospective study, what we feel is that whatever is done, we have to collect the data.
Collect the data. Okay. Right.
You must have collected the data, na? All for the patients who have already been undertaken treatment.
Yeah.
Huh? This is what you have done.
Pardon me?
Basically, just I want to know how you have done the retrospective study, how you collected your patients of 50.
We have taken on the basis of the symptoms which you have presented, the severity of the symptoms which they presented, ma'am.
In the
and
OPD?
the PSA value.
In the OPD?
PSA value. Yeah, OPD, ma'am.
In the OPD? Okay.
The severity of symptoms which they presented and the PSA value which we had done, which was less than 4, we had taken that cases.
And have you done the literature review for the studies which were conducted earlier?
Yeah, we have done that, ma'am.
But you have not reflected anywhere.
Okay, right. In the present
study,
okay. Yeah.
Since BPH is the disease where most of the studies have already been conducted.
Yeah, ma'am. Anyway, we'll include that also and try to improve in the study also again further.
Okay, thank you so much.
Yeah, thank you, ma'am.
Thank you, ma'am. Any queries? Since there are no queries, I think we'll move on to the next speaker. We have Dr. and Aksita Savani. She'll be presenting on the topic Role of Homeopathic Constitutional Medicine in Pseudo-Surgical Disease, Urolithiasis. Thank you.
Okay. Hello everyone. My topic is role of homeopathic constitutional medicine in pseudo-surgical disease urolithiasis. Basically, we all know that homeopathy is the science based on an individualistic and holistic approach to the disease following our fundamental principles. As per study by World Health Organization, it is estimated that 11% of a global burden on a diseases that can be treated with a surgery. But in a homeopathy, as per Hahnemannian classification of the disease, surgical and pseudo-surgical diseases are a part of a local maladies of a dynamic disease. Surgical disease in which surgical intervention is mandatory. For example, in a severe injuries, congenital anomalies, life-threatening conditions, and rest of the all the disease conditions were fall into category of a pseudo-surgical disease. In a homeopathy, primarily we consider the disease as a dynamic derangement of life force which persists for a longer time and produce certain disease products in a form of tumor, warts, prolapse, stones, and so on. By surgical removal of such a product, never change the underlying pathological process, and people may tend to get recurrence of their complaints. So if we talk about a urolithiasis, which is a highly prevalent in Asia, about 1 to 19%, and in India about 7.6% of population. That means 2 million people per year gets affected with a recurrence rate was 26 to 53%. That is a great impact on a quality of life of those who have been affected. And some part of the India has been denoted as a stone belt, which include Gujarat, Maharashtra, Punjab, Rajasthan, Delhi, Haryana, and some part of northeast side. If we talk about its management in a modern medicine, it has been managed with a conservative and surgical measures, which provides only temporary relief and leads to some side effect. For example, following extracorporeal shockwave lithotripsy, which is prevalent nowadays, and it causing 63 to 85% of the patient causing acute renal injury. So if we kept in view the recurrence and incomplete cure of treatment, then limitation and complication and expenses of a conventional medical science needs an alternative therapy, such as a homeopathic constitutional medicine, along with a diet and lifestyle modification, which provide a real solution to the patient and which is a cost-effective, gentle, safe, and risk-free, and has been demonstrated to be effective in relieving the acute complaint, removal of stone, as well as significantly decreasing its recurrence and restoring the health of the patient as a whole. So main purpose of this study is to study the homeopathic concept of pseudo-surgical diseases and to treat the cases of urolithiasis with homeopathic constitutional medicine. We all know that homeopathic therapeutic medicine will help in relieving acute suffering and also help in expulsion of stone. But I have found in many cases where strong tendency of recurrence of their complaint since many years and strong family history, where this approach is beneficial. So this analytical clinical trial was carried out and 50 cases of urolithiasis were surveyed through homeopathic case taking, out of which 30 cases were selected as per inclusion criteria, including irrespective of all age group and sex. And the cases with acute emergency, congenital anomaly, and severe irreversible pathological cases, and if the stone size is larger than 20 mm, were excluded because it was a time-bound study. Then data analysis was done in a following criteria. So first one was a significant improvement, means general sense of well-being with a disappearance of a presenting complaint along with a removal of stone and without any relapse for at least 6 months. Then in a moderate improvement, there is a general sense of well-being, reduction in intensity and duration of a complaint, and also there is a reduction in a size and number of stone. Then in a mild improvement, there is a mild reduction only in intensity and duration of complaint without any change in a number and size of the stone. Then urolithiasis symptom score scale was used for assessment of the patient before, during, and after the treatment. and whatever data was obtained from this scale has been used in a statistical analysis with the help of a paired t-test in a Microsoft Excel. So here we can see in observation table, in the first one, there was in a chart of age group, 31 to 45 year of the age group was more prone to development of a urolithiasis, which indicated that this group was more prone to have a laborious work, less fluid intake, irregular diet habit, and suffering from more occupational stress as compared to the other age group. If we look at the second chart about the size of the stone, it is I would like to say about it was a common belief in a conventional medicine that if the stone size is a more than 7 mm, need to be removed surgically. But there are many documentation were available and published in an article where homeopathy act marvelously in a expulsion of a bigger size of the stone. So I have also found the biggest size of the stone was 14 mm and smallest size of the stone was a 3 mm in this study. Here we can see in a chart of remedies. As per individualization approach, I have given a Nux vomica in a 4 cases and Lycopodium was given in a 3 cases. Then Madorinum, Sepia, Lachesis, Calicab, Heterambu, this medicine were given in a 2 cases of each. Here we can see that in a chart of a result, 73 to 34% patient having a significant improvement with this approach. In a table of a result, we can, if we look at the mean before the treatment and mean after the treatment, there was a great difference. Mean before the treatment was 8 and after was 1.2, which is showing a positive effect of our medicine in a cases of urolithiasis. And the T tabulated value was lesser than the T statistical test, which is showing a significant improvement in a cases of patient of urolithiasis. Thank you.
Thank you, Dr. Savani. Request the chair, Dr. Wonfock, ma'am, please.
Okay, may I ask for some clarification of I saw on the poster that you use simple randomization to select out the 30 patient over 50. Would you please explain on what do you mean?
Yes, ma'am. Through the homeopathic case taking, 50 cases of urolithiasis were surveyed with the help of a simple randomization and as per inclusion criteria. Whatever cases come in our study, we have included.
So you have tracked all the 50 cases and then you do the randomization and then you select the 30 patients.
Yes, ma'am. As per inclusion criteria.
Randomization, what do you mean by randomization then?
Yes, ma'am, you are right. Randomization means we are randomly selecting a patient, right? But as per inclusion criteria, and my topic was suggesting homeopathic constitutional approach, right? So those cases have been treated with some therapeutic medicine or those cases where mother tincture was given that I have excluded.
So there are 50 patients that comes in and then you randomize them into whether you include it or exclude it, and then you select out. Because for observational study, usually we would expect like a flow chart of like how you select the patient, because there can be strong selective bias if we select our patient in a specific way, so that it would have a strong bias to our result. So it would be best if, for an observational study, it would be really important to show the flow of how you select the patient. Maybe you can improve in this area next time. And the second question is, what is the p-value of the pair t-test? I did not see it on the graph. On the poster.
I forgot to mention in this table, but p-value was 2.43 E12.
Sorry, the p-value is the
2.43. 2.43.
2.43.
Yes, ma'am. E-12.
But that is not significant. If it is a significant.
That means, ma'am.
If you just from if the mean a pair t-test, if the mean have such a large difference, the p-value should be less than 0.05.
Yes, ma'am. 0.0. यस मैम, जो 0.0 है वो है ना E-12.
Okay. All right. I guess
2.43.
okay. I guess p-value should be
E-12. That
yeah.
means suggesting a 0.12, and after that this value was coming.
Okay. Yes, it should be included as it is
Yes,
essential.
ma'am. Yes, ma'am.
Yeah.
Yes. Okay, ma'am.
Thank you, ma'am. Dr. Praveen, ma'am, please.
Dr. Akshita, what Dr. Folk was asking you is, basically, what you did is not assess the randomization. Basically, for taking the cases as per the inclusion criteria, you have screened 50 cases, and out of that, as per the inclusion exclusion criteria, you have selected 30. Is that so?
Yes, ma'am.
So you should not use the word randomization, because randomization is something different. When we randomly select the cases, and you have selected, screened the 50 cases,
intentionally
and then
I have selected. Yes, ma'am.
Then
Yes,
you have selected 30 cases. But as per your inclusion criteria, you are mentioning that it was cases with irreversible pathology and reversible pathology. You have been excluding the cases or including the cases in your study. So how do you say
Yes,
that the cases are with reversible pathology by the case history? Or
yes, ma'am. Reversible pathology means location of the stone, and also is there any complication? For example, mild, moderate, or severe. Likewise, whether there was any hydronephrosis or any infections. Likewise, we have to look for a complication of the patient.
So, what investigations you performed for that?
For that, urine analysis, basic CBC count, and urine analysis was done, urine protein micro, and blood urea, creatinine, and then serum calcium.
You have not
serum
mentioned
calcium,
the details of
yes,
the investigations performed for also, na?
Yes, ma'am.
And have you done the literature review for the study of conducting the study for urolithiasis? And your topic says that you want to have the effect of constitutional medicines, but you have not highlighted that area also, because your aim was that, na, to just see the effect of constitutional medicine. Did you find any limitation in your study?
In 2 cases, I have not get result with a constitutional medicine, and then the 2 cases I have to switch over and refer to other intervention.
Which other intervention?
Surgical. There was an immediate need to remove that stone. That's why I have referred them.
Okay, so that should be highlighted in your study, na? Okay. Okay. Thank you so much.
Yes, ma'am. Okay. Thank you, ma'am.
Thank you, Dr. Praveen. Since there are no queries, I think we'll move on to the next speaker. Dr. Savani, yes. Yeah. Next, we have a case report on 15 mm urinary calculus expelled with homeopathic medicine. Dr. Archana Narang will be presenting on behalf of Dr. Seema Rai. Dr. Archana.
Namaste. Good morning to all. I am presenting this case. Am I audible and visible?
Yes, ma'am. Perfect. Please carry on.
Right. So I am presenting this case report of a 15 millimeter urinary calculus expelled with homeopathic medicine. My previous speakers have also spoke about the prevalence and incidence of the nephrolithiasis, which is very, very common these days. And it is the 3rd most common disorder of the urinary tract after urinary tract infection and prostatic hyperplasia. So the aim of presenting this case report is to show the remarkable effect of sarsaparilla and the potential of homeopathy in controlling the cases of large urinary calculus. Now, the case which I am talking about is about a male, 24 years of age, dark complexion male who presented at the OPD of Nehru Homeopathic Medical College, New Delhi, India. The patient attended the OPD with the complaints of severe acute cutting pain in the right lumbar region, which extended to the lower abdomen, and the complaints were since 4 days. But when the history was taken, it was revealed that this pain was not only for 4 days, but he was experiencing this pain since last 2 months. But because the pain was only dull aching sensation in the lumbar region only, he ignored it. The problem began 4 days back when he started having a problem in urination. The flow became intermittent and the stream was feeble. And then he started experiencing excruciating pain, which increased in severity day by day. When he attended the OPD, only from the faces of the patient you could realize how much pain he was experiencing. And because of his pain, he was very much sad and depressed at that time. Moreover, patient also told the very important symptom that he was experiencing pain, especially at the closure of the urination or at the end of the urination. The intensity of the pain was too much. So we prescribed a number of investigations for the patient. The routine hemogram was done. Serum calcium levels were also prescribed and renal function tests were performed, which were all within normal limits. But the routine and microscopy of urine revealed RBCs in the urine, which were 4 to 5. The ultrasound of the abdomen was also done, which revealed a calculus of 10 millimeters in the lower pole of the left kidney, a 3.4 millimeter concretion in the right kidney, and a 16 millimeter calculus in the right uretrovesicular junction with the upstream hydronephrosis. The patient was examined thoroughly. The symptom score, urolithiasis symptom score, was used at the baseline and in the subsequent frequent follow-ups, which were done after every 3 days. And on the basis of acute totality and the presenting symptoms of the patient, sarsaparilla was given in 30th potency 3 times a day for 3 days. And then it was also repeated in the next 2 visits. After on every 3rd day, patient was followed, and it was seen that there was a remarkable decline in the symptom score. So the patient was relieved of the pain, and therefore the sarsaparilla was repeated again for 2 more times. A patient reported us on 25th of June 2019, and after 11 days, patient complained of a colicky pain followed by little bit of hematuria, bleeding in urine, and then expulsion of the stone occurred. Because at the very outset, we advised patient to use a sieve while urinating, he collected the stone and we measured the stone. We found that the stone measured 10 millimeters into 15 millimeters. With the expulsion of the stone, all the pain and other complaints of the patient subsided. The follow-up of the patient was done and was prescribed Saclec. Patient was prescribed placebo in the subsequent prescriptions also, but the ultrasound was again performed on 17th of August 2019, and it was found on ultrasound that there was no calculus which was previously present at the UV junction. Moreover, it was also found that a calculus which was present on the left side, little bit reduced in size to 8.8 millimeters. There was also improvement in the concretion which was present on the right side, and it reduced to 2.3 millimeters. All other reports were also done. The blood reports and the urine reports appeared to be within normal limits. Because we all know that there is great tendency for the recurrence of the disease in cases of urolithiasis, and therefore the patient was prescribed a constitutional medicine. Lycopodium 200 3 doses was prescribed. Patient was further followed up, and we followed up the patient till March 2020, but after that, because of the outbreak of the corona pandemic, patient returned back to his village and we could not follow the patient further. The conclusion of this case report is that it clearly shows the remarkable effect of sarsaparilla on the urolithiasis. We all know that the urolithiasis carries a lot of economic burden on the healthcare system. As my previous speakers also told, that almost 2 million people in India suffer from urolithiasis of one or the other kind every year in India. So it causes a lot of burden on the economic system, economy of the healthcare system of India. And we also did the literature review, and we found that in conventional medicine, they say that there is spontaneous expulsion of the stone in the urine up to 7 millimeters. And in few cases, they have also reported expulsion up to 10 millimeters. But they say that almost in all the cases which are more than 10 millimeters in size, the surgical intervention is needed. So this case report clearly tells us about the efficacy of homeopathic medicine in urolithiasis, even in the large stones, which are the surgical stones, which has to be removed surgically otherwise. At the end of the presentation, I would like to acknowledge and thank my patient for his cooperation and providing the necessary information to complete the case. I also express my gratitude towards the Indian Journal of Research in Homeopathy for publication of this work. Thank you so much.
Thank you, Dr. Archana. Dr. Von Fock, ma'am, please.
Thank you for the presentation. And yes, I like this case. It seems to be very encouraging. But of course, we need to know what are the limitations and what are the potential points that we may further elaborate, so that we can be a bit more sure that it is not a spontaneous kind of expulsion. Is there any aggravation of symptoms during the first 3 days, or no? It's just a relief of pain, number one. And second is, how was the overall well-being, or is there any other symptoms that is besides the pain? Is there any general symptoms that has been improving during the treatment phase?
Ma'am, in the when the patient first of all visited the OPD, we prescribed the medicine only on acute totality and pathology of the patient. And the medicine was selected on the symptoms with which the patient presented. Like one important symptom with which the patient presented was severe acute pain at the end of the urination. Patient was having pain during urination also, but it was intolerable at the end of the urination, which was very important symptom. Patient had dysuria also. And pain which was present in the lumbar region on the right side, extending down to the abdomen. And because of the affinity of the sarsaparilla on the right side, the pathology which was present, and along with that, the important mental symptom the patient presented was the despair, despondency and sadness because of the pain. Normally patients, they present with anxiety or fear, but here the important symptom was sadness because of the pain, which is a very important symptom in sarsaparilla. And because at the very outset, the scoring was done using the urolithiasis symptom score, which is developed by CCRH only, that we use that scoring system only, and we assess the patient on every visit. Every third day patient was asked to visit. Yes, definitely there was a limitation that we tried to follow up this case for a long time also to see the effect of the homeopathic medicines on the other stones which were present. Though till March 2020, patient did not develop any kind of pain or urinary complaints as such. We repeated the urine report, urine microscopy and routine test also to see whether he develops any UTI or any other problem. The renal function tests were performed every 6 months, but all of them were all right. But due to the corona pandemic outbreak, he went back to his village, and after that we could not contact the patient as such.
Okay, thank you. I look forward to the publication of this case report. And if you can, please do add the Monarch scoring so that the information reported can be better appreciated?
Yes, ma'am. The scoring and all the reports are there in the publication itself. Because of the space constraint, we could not show all the reports and all the follow-up scoring. But at the outset, at the baseline, the scoring was 16, and then it reduced to 5.
I mean the Monarch score. The Monarch score, the score for causality assessment for homeopathy. You may try to work on those areas. It can help the quality of the case report.
Definitely, ma'am, we will do in future. Thank you so much for your suggestion.
Thank you, Dr. Fogg. Dr. Praveen?
Dr. Archana, it was a nice presentation of the case, but I would like to know whether the hydronephrosis was also reduced in your further testing?
Yes, ma'am. The follow-up ultrasound was done on 17th August 2019, and it showed that there was no hydronephrosis.
Okay. Thank you.
Thank you, ma'am.
Thank you, Dr. Praveen. Now we'll go on to the next speaker. We have Dr. Yashika Arora Malhotra, who will be presenting a case report on nocturnal enuresis cured employing homeopathy. Dr. Yashika.
Thank you so much, ma'am. Can I start screen share?
Yeah, please do.
Yeah. Is it visible, ma'am?
Yes, it's visible. You can enlarge it. Zoom it out, please.
Is it fine now?
It's fine. Please start.
Thank you so much. First of all, I would like to introduce myself. I'm Dr. Yashika Arora Malhotra, BHMS from Nehru Homeopathic Medical College, and I've completed my MD in Homeopathic Materia Medica from MEMUHS, and right now I'm practicing in Janakpuri, Delhi. And today's topic for this LMHI curriculum of mine is a case report of nocturnal enuresis that was cured employing homeopathy. So the background and regard on this topic, as well as the case report, we are going to discuss first. As you all know, that nocturnal enuresis is involuntary voiding of urine while sleeping by children who are old enough to be expected to have bladder control. If the incidence is occurring twice weekly, so then we can identify or diagnose it as nocturnal enuresis. More than 85% of the children usually attain complete diurnal and nocturnal control over their bladder by 5 years of age, but still there are 15% who take time, or around 5 to 10 years of age, who can attain their complete control over the bladder. And otherwise, if you talk about the beyond the 10 years of age, it's only 0.15% of the children who can attain, who are still left with attaining of this nocturnal control or the diurnal control over their bladder. So if the child is having is not having control after 5 years of age as well, so we diagnose it as nocturnal enuresis. And at that time, behavioral management, as well as there is a lot of scope of homeopathic medicines such as Cinna, Causticum, Belladonna, Equisetum, various remedies which can be prescribed, which help to cure such cases, treat them symptomatically. So when you talk about this case, the case was of a female child aged 9 years of age. She was suffering from bedwetting, and she came around 2 years back to the clinic, and she was having a complaint of bedwetting every night. At times, she used to pass urine 2 to 3 times during the night while sleeping. Because of this, she was very much afraid to go to bed, as she had a fear that she'll make the bed wet. While taking the history, Her milestones were found to be very normal, as well as regarding the physicals and the mental generals. The physicals included a decreased appetite. She usually the marked symptom was she hardly ate until she was forced to eat. She was a very chilly patient and had extreme desire for sweets. Talking about her mental generals, she was an intelligent, responsible girl. She used to study on her own. The parents reported that they do not have to force the child to study. And she used to mingle with people easily. But at the same time, when she used to go to crowd, she was a little timid child in the crowd whenever there were more people. She was very fearless, oversensitive, very yielding. Whatever you could say, she could do it. Plus, she was at the same time, whenever she used to see anybody fighting or see anybody in pain or in need, she was very sympathetic towards them and used to become sad, or while she was even a little child, she used to cry whenever everybody was used to fight. She used nowadays, whenever she used to see in any person in need, she tried to help with whatever she could. On this basis of symptoms, and after the complete repertorization in materia medica knowledge, the simillimum causticum was selected, though the remedies which came out to be indicated were sulfur as well as causticum cinna. But regarding her sympathetic nature and responsible child, yielding, at the same time timid, she was prescribed causticum in hypertension. At the interval of 10 minutes, causticum 200 was prescribed, because being a child and very susceptible, very active, very intelligent, she was given the hypertension, empty stomach on the very next early morning. She reported to me after 15 days with a very slight decrease of frequency. Like she passed urine 3 times during the night, and now she passed around 1 to 2 times, or at least a time every day she was passing the urine. Then after placebo was continued, and after 15 days of this time period, the mother again reported to me, and she said that she now went to she now used to bedwet around 2 to 3 times in a week. After that, she was still better. For around 2 months she was better, but then the frequency still persisted. So she was prescribed causticum in a hypertension. That was a simillimum remedy, and causticum 1 one dose was prescribed very early morning the next day after 2 months. And after that, she gradually developed and became better day by day. And within 3 months, her mother reported that she's much better, and rarely she's doing like 15 days, only once a day she did. The placebo was continued, and after that she reported after 4 to 4.5 months that she was completely better, and now she's not complaining. So she was not prescribed any medicine, and I'm still in touch with the mother, that she is still normal. So the conclusion I would like to include is that individualized homeopathic treatment proved to be effective whenever you are dealing with cases of nocturnal enuresis in children. And in this case, the constitutional remedy not only elevated the patient, but also prevented that she should not increase this episode till date. Thank you so much. I would also like to acknowledge Dr. Vibhu Malhotra, who is a consultant along with me at my clinic, and he also supported in the case. Thank you so much. Thank you, LMHI.
Thank you, Dr. Yashika. Dr. Falk, ma'am, please.
Thank you for the presentation. There are a few things that would like your clarification. First, what do you mean by 200C at the interval of 10 minutes every morning?
Ma'am, the Costicum 200 was prescribed. Four pills were prescribed, and the interval of every 10 minutes for 3 times. Early morning, empty stomach.
Yeah. So it is like one dose, and then after 10 minutes another dose, and then after 10 minutes another dose, and every day you repeat this.
No. Only the single date was repeated. After that, the placebo was continued. After 2 months, the higher potency of single dose of Costicum 1M was given.
Okay, so it's just day one that you give the remedy.
Yes,
and then after 2 months you give the 1M, and there's just a setback in between.
Yes, setback was going on.
Okay, thank you. And second is how is I do not see any report on the general symptom of the patient, like her appetite, like her chilliness, like her maybe how are those changes?
Yeah, ma'am, the issue was actually because of her appetite decreased. I also advised them deworming along with this, along with our prescription. So I asked the parent to get the deworming done, because every 6 months, like we usually when we are dealing with children, so they can be having, they may have or complain of decreased appetite because of their because of worms, etc. So automatically once with the medicine, after deworming, her appetite was also very much like she could eat. She used to have food. She was not asking, but yes, normally she had food. Now she's normal. Actually, her health was much fine, so the parents were not concerned about that appetite much. They were more concerned about the enuresis, but then deworming along with the medicine made it better.
Okay, yeah, these general symptoms should also be reported in an homeopathic case report, so that we can understand the patient do not only improve in that indicated in that pathology that is the chief complaint. But on the other hand, I would also like to highlight that as it is just a case report, it would be not so appropriate if we make too strong a statement at the conclusion, like curing, like empowering, that it is a direct causality. This kind of statement cannot be, it is not appropriate for a case report study. Otherwise, it would be like an overstating, because if from this case, it can still yet be a spontaneous recovery, right? Yeah, so I think we should try to avoid too strong a conclusion for a case report. And it would be better if you also report the follow-up time and also the monarch criteria, so that we can have a more objective evaluation of how likely we can conclude that there is a causality between the remedy and the results.
Sure, ma'am. I'll take care of this next time for sure. Thank you so much for your suggestion.
Thank you, Dr. Vok. Request Dr. Praveen, ma'am.
In addition to what Dr. Folk said, I will like to add, because this disease is basically a psychosocial disease also, and you have not taken any care of any symptomatology of psychosocial cases, symptoms. What were the stress factors? What made the patient to suffer like this at the age of 9 years?
Ma'am,
how that counseling was done for that?
Ma'am, along with the medicine, the behavior, the counseling and the behavior management was continued. She was advised, the parents were also advised that she should not drink lots of water at night.
That is the management part. That is the management part.
Yes, ma'am. And regarding the mental generals, the Costicum was also was prescribed on the basis of repertorization. We took yielding nature, the oversensitive nature, sympathetic nature, yet timid at crowd. She was fearless, but all the symptoms were together considered, and then
I mean to say, I have read your case. I mean to say, what was the positive factor for that? Because every children at the age of 9 is not doing so.
Yes, ma'am.
There must be some stress factor or some positive factor or related to mind. how that was taken care of should be mentioned, also be mentioned. Okay.
Okay, ma'am.
Thank you.
Okay, ma'am. Thank you.
Thank you, ma'am. I think we'll move on to the next speaker. We have Dr. Annapurna Sarangi, who will be presenting on the effectiveness of homeopathic drugs in urolithiasis, an observational study. Dr. Annapurna.
Okay. So good morning, all of you. Myself, Dr. Annapurna Sarangi, are working in Department of Metromedica, Nehru Homeopathic Medical College and Hospital. One minute. Okay. So myself working in Department of Metromedica, Nehru Homeopathic Medical College and Hospital. So my topic is effectiveness of homeopathic drugs in urolithiasis, which is an observational study. So introduction, urolithiasis is a common problem encountered nowadays in modern system of medicine. Surgery and lithotripsy are the usual mode of treating renal calculi. Urolithiasis, it affects around 12% of the world's population at some point during their lives. It affects people of all ages, genders, and ethnicity. Although it strikes male more commonly than the female between the ages 20 to 50 years. Urolithiasis is a risk factor for chronic renal disease. In addition to the typical possible consequences of kidney stones like pain, infection, and blockage. Though the allopathy system so far considers that it is impossible to dissolve calculi by any kind of medication, many cases are successfully treated with homeopathic medicines. Homeopathy comes with the rescue of patients here and avoids the burden of surgery in most of the cases. Homeopathy not only removes the calculi but also prevents its recurrence. And my aim is to find out the effectiveness of homeopathic medicines in the treatment of renal calculi, which is an observational study. Methodology is that this project is conducted in Nehru Homeopathic Medical College and Hospital. The patients were chosen from the cases reporting to the OPD, especially on Friday, and IPD as well. Then they are taken up for counseling on the different issues related to the research project, and a written consent is obtained from those willing to participate. On selection, each case is recorded on a structured proforma, and the research team carry out the detailed history and examination of the patients. Then the cases are followed up weekly for subjective and objective symptoms. Here, there are three treatment plans are used in different groups. First group with constitutional medicine only, second group constitutional with organopathic medicine, and third group only with organopathic medicine. Apart from this, there is a assessment of the severity of the disease condition is also done at the first visit and then during all the follow-up visits. Here also we use USSR score, that is baseline assessment scoring form, where containing 8 items like pain, hematuria, dysuria, and number of stones, size of stones, and also the position of stones in kidney, ureter, and bladder. And it is also filled up during each visit as a part of research study going on renal stones. So this is the methodology. Then comes the improvement criteria. How to assess the improvement criteria? First assessment is done by the symptomatic assessment, and symptomatic assessment is done by the mild relief, which is known by there is decreased intensity of pain, and where patient has to take painkillers less frequently. Then moderate relief, where there will be slight pain and there is significant relief in other associated symptoms, and here patient will does not require any painkillers for the renal colic. And asymptomatic, where there will be no symptoms and any other associated symptoms. Then this is symptomatic assessment, mild, moderate, and asymptomatic. And also there is investigative assessment is also done by ultrasonography, X-ray, and also IVP, intravenous pyelography, where we can assess the size reduction of the size of the stone, and also partial expulsion if there is multiple stone, and also there is if there is complete expulsion of the stones in that. And also USSR score is also maintained, and in USSR score there is total score is 22, and if symptom score you will be lined according to the sum of 8 circle numbers. If there is 1 to 7, that means mild. If there is 8 to 14, that means moderate. If there is 15 to 22, that means severity. So here also in that way do we also assess the case report and cases of improvement assessment done in the urolithiasis project. Here also the next my graph shows that the response of the response of treatment with all homeopathic medicines, mostly in 58 percentage it has helped in expulsion of the stones, and it has given 15% relief in moderate relief, and also 12 percentage and in mild relief, and 12 percentage in asymptomatic, and 3 percentage cases also drop out. And the next graph shows the number of cases of expulsion of stone by constitutional medicines. Every constitution has shown their own uniqueness and gave 100% result in expulsion of the stone, and that too especially given by shown by the lycopodium. So lycopodium, it has also given good result in expulsion of the stones. Then here next third graph shows that like result of lycopodium, where in total it has given in 25 cases. In that asymptomatic the cases become asymptomatic 7, and expelled cases 8, and there is mild relief in 2 cases, moderate relief in 4 cases, and there is also partial expulsion in 4 cases. Then coming to the my result or conclusion in this observational study, constitutional with organopathic medicine has given excellent result in expelling the stones. And also next comes constitutional medicine alone has given good results, and alone organopathic medicines that has also given good result, especially in symptomatic relief. And lycopodium and naxomica has given 100% expulsion result, whether given alone or in combination, either with organopathic or in constitution alone. Berberis vulgaris mother tincture is found to be most effective in renal stones. Arnica and tabacum is in repeated doses help in relieving the pain, hematuria, burning sensation, nausea, vomiting, and perspiration. Berberis has also it has shown good result in bilateral stones. That is also, and also arnica if there is sensation of passing calculus in urinary tract, and also it causes injury while passing the calculi. So it helps in relieving the soreness during the expulsion of the stone, and also after the expulsion of the stone, during and after. So this is an observational study with the positive results, and these results need further validation by conducting clinical trials. And based on this study, NHMC and the hospital intends to take up randomized control trial, keeping in consideration the drugs which have been found useful in cases of urolithiasis. Thank you.
Thank you, Dr. Annapurna. Dr. Wonfock, ma'am, please.
Thank you for the presentation. Just a few points to clarify. I saw on the poster that you say the sample size will be a minimum of 50 cases. What is the final sample size that you have? I mean, I do not mean the estimated sample size, but the real sample size that you got.
Sample size is a minimum 50. More than that also you can take. And here it is a year-wise project also we are conducting, and for the study is also still going on.
Oh, but for this, because you're kind of like summarizing the results, right? How many cases were included in your report?
In the report, 56.
56. How many of them, because I do not see how many of them are prescribed constitutional only, and then constitutional plus organopathic medicines, or organopathic medicines only? What is the distribution?
What is the there is no exact size distribution, but we have categorized around this constitutional medicine in 30 cases, and constitutional only, not only in constitutional with organopathic medicine 30 cases, only constitutional 17 cases, and other organopathic medicines.
But then they do not add up to 57 that you have mentioned.
No. It is 50. More than that also we have taken.
Okay, so Dr. Anopara, if you're presenting an observational study, these kind of details are essential, because nobody is going to clear about what are you talking about when all these details are missing. And if you want to report, then you got to set a timeline that how many cases were included, and then report. And the conclusion, I cannot understand the conclusion from the results that you have presented, the graph that you have presented, because I cannot see the results from the constitutional remedies only, or constitutional plus organal medicine only, or organal medicine only. These are all not reported. So you cannot draw such a conclusion because you have not reported. And right, yeah, and you also need to specify how you determine whether the patient would use organal-specific medicine only, or constitutional remedy only, or both of them, because that can also cause selection bias when you assess the results. So all this kind of detail got to be reported.
Okay, thank you.
Thank you, Dr. Folk. Dr. Praveen, ma'am, please.
I agree with what Dr. Folk has said, and there is a lot of confusion. While presenting, you told that lycopodium was prescribed in 25 patients, which was relieved in as constitutional remedies. But now you are saying that only 17 patients were taken for under constitutional medicine. So there is some confusion which is to be sought out, and these type of confusion should not occur. And you should specify when the patient is being given constitutional medicine, when the patient is being given organopathic, and when both are to be given. There should be some criteria which has because otherwise it will be just random. And while you're saying that you will be conducting randomized trials, here how you selected the patients in 3 arms, it is not clear.
Okay, ma'am.
So for better clarity, it should be clearly mentioned in the study. Okay. Okay, thank you.
Thank you, ma'am. Now we have come to the end of today's morning session. I would like to request the chair, Dr. Folk and Dr. Oberoi, to please summarize the session.
I do enjoy meet at start fast, Dr. Praveen. Is that okay?
Yes, ma'am.
All right. So thank you for all the presentations from different presenters, and it is very encouraging to see such many submission from different area and from different settings. And yes, case report and observational study actually contribute quite a significant portion in our evidence base, and but the quality of the reports needs we need to keep the standard of the quality of the report in a more standardized way, so that our evidence base can be built up in a more solid way. I hope the suggestion that we have given so far would improve the quality if you want to publish your case report afterwards.
Thank you, ma'am. Dr. Praveen.
I would like to congratulate all the participants and presenters who have been given chance and who have make efforts, sincere efforts to have their presentations and their posters, and they have been given for oral presentation also, chance for oral presentation. And this is the forum when we basically when we are saying to improve ourselves, like ma'am has also said, that publication is one of the major aim once we are having any study being conducted, any study. And if it is not published, it is of no use. So for better having the publication in a better journals, we need to improve ourselves in methodology and in presentation also, and in expressing the results also. That is, and in this session, we had almost 15 presentations, and out of these maximum were of the urinary symptoms, which is the major area having the socio-economic status also. And here we have given the suggestions for further improvement. Thank you so much.
Thank you, ma'am. We have Director Ayush, Dr. R.K. Manchanda with us. Sir, would you like to share a few words?
Thank you very much. Both the chairs, Dr. Parveen Oberoi, Yuan Fock, and our team of moderators. I also congratulate all these speakers for wonderful presentations. And I think there was a lot of learning, and all these things will help us to produce better research and better publications in times to come. I'm also thankful to all the participants, those who are going to join and are already joining this on the other side of the screen that we cannot see. And I know there are hundreds even at this time of time. Thank you very much for giving me this opportunity to be here. Bye-bye.
Thank you, sir.
Thank you, sir.
So we would like to thank the chair, Dr. Yuan Fock and Dr. Parveen Oberoi, for sparing their valuable time and enriching the session with their valuable suggestions and constructive criticism. I'm sure this will go a long way in improving our research methodologies and also our skills of research publications. I would also like to thank all the speakers for their presentation. Thanks are due to all the attendees and the coordinators, Dr. Aishwarya and Dr. Akshita and the technical team. It was a great learning experience. Looking forward to more such enriching sessions in the upcoming days. Good day to all of you. Thank you.